Are you on a thyroid medication? Been on it for a while? Still not feeling well? Ask yourself this. Is your pill still helping you, or is it masking a problem? There's something to think about. Is your pill actually a Band-Aid for what the actual cause is, and that's why you're not still feeling well? Let's talk about this, because I have an offer for you later on in this video for you to actually determine if that's the case. All right? First, let's do a little bit of explanation of what's going on with your thyroid, and if you are on a pill, why the doctor prescribed that. Your thyroid gland produces this thing called T4. That is the hormone that your thyroid needs to produce. Okay? And then there is a communication from the brain, and it is using this thing called TSH. The brain knows that T4 might go low. If your thyroid's not doing its job, T4 is going to drop. That feeds back a loop into the brain. Okay? And then the brain says more TSH. You go to see the doctor, the TSH is up. They see your T4 is low. Sometimes they don't even run this, but they might. They see that, boom, time for a medication. And here comes your Synthroid. Here comes your levothyroid, excuse me. All right? To the rescue. And immediately your T4 levels out. They're just giving you medicated T4. Okay, that's great. And theoretically, that should help. But there's a lot more to this picture that might be going on that your doctor didn't test for, so they don't know. So let's look at it. Here are some things that can also happen with this. What if you're not converting T4 to T3? Because this is the active hormone that you need to know. This is the one that actually acts on your cells to make you feel better. You have low T4, okay, but what if the problem wasn't T4? What if the problem really was low T3? That's the issue. So they give you the Synthroid levothyroid, the levothyroxine, the T4 levels out, but you're still not converting this. This isn't happening right here. You're still not going to feel well. You got to fix this. To fix it, you got to test it. That's where the medical profession is missing out on a lot of this. They don't actually test enough. Do the right testing, all right? So that's one reason. Another reason, there's this thing called, I'll put it in red, there's this thing called reverse T3. And reverse T3 is a hormone. It's almost like the brakes on this whole process. The body can kind of, even though the gas might be running, the car is going fast, it can put on the brakes using this reverse T3, and it slows us all down. Reverse T3 will block the effects of T3. So you can test T4, could be looking normal after you get on a medication, and your T3 might also then look good. But if you don't run the reverse T3, you're putting on the gas and you're putting your foot on the brake at the exact same time. Not getting anywhere, still not feeling well. Is your doctor testing for this? You have to be tested for this. If you're not going to feel well. The other thing that thwarts this whole process is your adrenal glands or adrenal stress. Okay? So when you're under, and there's all kinds of reasons for that, and that's a whole other video at a whole other time, but just know that if your adrenal glands are really fired up, making a lot of cortisol, that fight or flight hormone, and you're really stressed, that blocks TSH from doing its job, and it blocks the production of T4. So you can take this medication, not T4, T3, it blocks it right here. So you can take Synthroid or levothyroxine and it increases your T4, and you feel or should feel better. But if adrenal stress is blocking your brain's communication to your thyroid or blocking the conversion of T4 to T3, what's the point? You're just taking an inactive hormone that's not going to do anything in the body because it's not converting to T3 due to your adrenal stress. You have to fix these things. Your medication is just a Band-Aid that you're slapping on a gushing wound. It works for maybe 5 seconds, but then all of a sudden the blood works its way underneath the Band-Aid and you haven't gotten anywhere. You're not fixing the problem. You got to stop the bleeding. You got to stop whatever's going on here from happening so your thyroid can work properly. Do this all day, and I see this time and time again with our patients. Don't suffer any longer. At the bottom of this video, here is your offer. I want to sit down with you and find out if this is your case. You start with us with a phone call. It's free, 15 to 30 minutes. We want to make sure you're a good fit for our office. You also have questions you might want to ask. You can ask them at that phone call. At that point, we can start to work on what testing we need to do to figure this out because your doc's not doing it, okay? You're being led to believe that the problem will be fixed with a medication that's just a Band-Aid. It's time to end that process and actually get to the root cause of what's going on. Now, you might think, I'm far away, I live in Hawaii or I live in Texas. We see patients from all over the place. We can send you the testing that you need, but it all starts with the free phone call, all right? Take advantage of that. Sign up using the QR code below. Get on our call schedule, and let's finally help you fix what's going on and not just slap a Band-Aid on it.